day everyone, welcome to Amcons TV, and on today's health discussion program we're talking about abortion. My name is Kwazima Matilda and here with me is
Ayashino Bolat Vestella.
Okay, thank you. We're not going to be doing this alone, guys. It's going to be an interactive section between us and the audience where you guys are going to give your opinion on what you think about abortion.
Today, we'll be discussing on a very important and sensitive topic, which says, how safe is abortion?
Thank you. Firstly, is there anyone who could explain to us what abortion is? Okay, thank you.
Abortion refers to deliberate termination of pregnancy before the fetus is born into a child. So abortion is also when a pregnancy is terminated before it results into a child. It's also called termination of pregnancy.
Alright, thank you. In addition, induced abortion can be performed in a variety of ways depending on the stage of pregnancy, which involves taking medication or surgically or any other method. The process of taking medication is when a drug is given to someone to help remove the baby. While surgical abortion, which involves removing the fetus and other contents of the uterus through surgical procedure such as suction aspiration or dilation and evacuation.
Abortion is generally considered a safe medical procedure when performed by a trained healthcare professional in a sterile and appropriate environment. However, as with any medical procedure, there are some potential risks and complications associated with them, right?
Yes.
So, can anybody enlighten us on some of these risks? Okay.
The most common reason of abortion are bleeding, infection, and it can also lead to death because when the blood is not badly flushed out the journey, then it can lead to death, and through that infections can come that can lead to the damage of the person's womb. Thank you.
Wow, that's very nice. And also, can anyone tell us how safe they think abortion is? Thank you.
The safety of abortion depends on the method used. The medical abortion, which involves taking medications to induce a miscarriage, is generally considered safe and effective, with a low risk of complication. We also have surgical abortion, which involves a procedure to remove the fetus and the placenta from the uterus. It's also considered safe when performed by a trained healthcare professional. Thank you.
Thank you.
Thank you very much. You have spoken so well. It is also important to note that the safety of abortion also depends on factors such as women's overall health, the stage of pregnancy, and the availability of healthcare facilities. In some parts of the world, access to safe and legal abortive services may be limited, which can also increase the risks of complications and harms to women's health. We'll be going on a short break. My co-host here will be going on live with a medical practitioner, Dr. Orekoya at Bamidele Olumilua University of Education, Science and Technology, Ikere-Ekiti, and also a father and a lecturer by name Mr. Kayode Fajobi.
Hi guys, if you're looking for a place to get your effective pink lips products, your lip scrub, your lip balm, your pink lips moisturizer, your lip gloss of beautiful and fine shades, hydrating lip gloss that help you and makes your lips look glossy and nice, look no further to AR Cosmetics. We deal with different shades of lip gloss, beautiful lip gloss, highly pigmented lip gloss that helps the lips and hydrates the lips. We also sell skincare products. Yes. My name is Kwazima Matilda. Can we hear you?
Well, my name is Adefolori Orekoya. I'm a medical doctor, but of course, that's my name, Adefolori Orekoya.
Okay, sir. Thank you, sir. So, I would love for you to shed more light on what abortion is.
Okay. Well, abortion for me, maybe because of my training both in theology, in religious studies, in mental health, and in medicine and surgery, is usually looked upon globally, just beyond the expulsion of a growing fetus from the mother's womb. I look at it most times from the psychosocial point of view as well, because there are a lot of issues involved in abortion. But just for the sake of this documentary, I'll limit it to medical abortion, so that we can wrap it up in good time. Now, abortion is simply the expulsion of a growing fetus from the womb of the mother just before maturation, before the fetus matures for extra uterine life. There is a part or a point where the fetus only survives in the womb, such that if you expunge the fetus away outside or from the womb into the outside world, the baby may not survive. So anything that is done to a growing fetus before 20 weeks of gestational age and the baby in the womb dies or is extracted or expunged is called abortion. It could be intentional, it could be unintentional, it could be induced, that is, you are going in there to bring about the abortion, to bring the baby out, or to cause the death of the baby, or it could just be spontaneous in the sense that the baby naturally just dies, because nature also does what we call sorting. Nature has a way of determining which fetus is fit for life, such that it is the divine intervening in the affairs of men, sorting out those who cannot survive outside the womb. These ones, they would develop what we call congenital defects. Maybe the head will not form well. Maybe the organs of the body may not form well. Maybe the eyes may not form well. So nature takes care of such ones such that they die naturally. And then you now find a way of bringing them out. So that would be a way of providing introduction to the subject matter.
Thank you, sir. Thank you very much, sir. So, sir, as a medical practitioner who has been in the medical line for a while, would you say abortion is a right thing?
Well, there's something we call the theory of necessity, in sociology. I said I usually will look at it globally, such that where there is necessity, you may need to consider it as the only way. If a child or a growing fetus has congenital anomaly and you are able to determine or discover before birth, then you are left only with the option of saving the mother's life. Or if there is a threat to the life of the mother, you are left with the option of only taking care and keeping the woman, alive. So, however, there is criminal abortion, in that you have it, because we know that life begins from conception. If life begins from conception, from the moment of fertilization, you already have a life growing. And that's why if there is abortion, whether induced or spontaneous, that is, whether it just happens naturally, or you go there to induce, you take drugs, abortifacts, and the baby comes down, what you see is blood. And in theology, we agree that blood is life. So the moment you have blood coming out, it means that the life had been taken, terminated. So it is synonymous. Criminal abortion is synonymous to murder. Because at that point, what you see is that one life had been taken away. So I would say that, I've tried to provide explanations in different ways to say that, one, if there is a threat to life, particularly the life of the mother, you may be left with no other option than to allow the natural process of abortion to take place or to induce it. However, if there is no threat to life, you are left with the option of keeping the child and allowing the child to grow. And that was why ab initio I also mentioned that nature does sorting. by itself and determines those who are fit to live.
All right, thank you, sir.
Yeah.
Also, sir, we also want to know your opinion on how safe you think abortion is. Do you think it is safe?
A function of who is doing it. Unfortunately, most people who do abortion patronize quacks. Of course, you can do medical abortion, you can do surgical abortion, or you can do instrumentation, to take care of the process. So the safety of the process is a function of who is doing it. Is he a medical practitioner? Is he a certified person? Is he trained in that art? Then number two, where is it being done? So, because we have to talk about aseptic procedure, many times the process itself may be safe, but the aftermath, you may not be able to curtail. What that means is that there is a sequelae, what we call post-abortal sequelae. That is what happens after the abortion is done. So it's not enough to just go there and take out the fetus or just give drugs and the person goes home, like we find quacks do. You just give medication, the person goes home, bleeds, and after bleeding you congratulate the person that the process has been completed. No, you can have incomplete abortion, which may require that you go there to complete it. You understand? So, and then after that is done, you may need to also place the patient on antibiotics or some drugs that will take care of the sequelae that will happen there. Even when you are doing medical termination of abortion, we know that it is also holistic. The management is holistic. It's not just to give drugs or to run fluid or to give injections. You may also need to provide psychological support or psychosocial support, because part of the complications of abortion is that you may have psychological problem. We have had people develop anxiety disorder. We have had people develop depressive illness. We have had people develop post-traumatic stress disorder following abortion, whether accidental, whether medical or what have you. So the management or the safety is a function of who is doing it. Is the person trained in the act? Where is it being done? Is the environment safe medically and psychosocially for that process?
Sir, I would love to ask a question. So, if a student comes in here and she says that she's pregnant, but she wants to, but her parent does not know about it, would you encourage her, or what is your advice to the student?
Great question, and that's an intelligent question, and I'm a very honest person. I don't know where this would go to, but I'm a very honest person. To say that I would rather help the patient and provide support beyond just the act for the patient, because I am a father of girls, and I want girls to understand that they can also live in the capacity of men. They are not supposed to beg life. They are not supposed to be begging life to experience life. So unfortunately, the problem with abortion is born. The challenges is born. The troubles is usually born by the female gender. So I have a soft spot for them. So when they come that way, I want to provide all the help and assistance I can offer. As much as I don't want to get into criminality, but I'll give all the help I can offer, because I also know that if I don't do what I should do, they may run into the hands of quacks. And that was why I was saying that for me, my view about it is holistic. It's not just medicine. I look at it from the social point of view. I look at it from the theological point of view. I look at it from the psychological point of view, so that we can have a balanced approach to it.
By my own understanding, that has to do with termination of the life of a fetus before delivery, putting an abrupt end to a life within a human being, so which can be illegal in most cases and legal in some areas too. As an academic staff, well, it depends on who is taking or having an abortion. If a staff is aborting a fetus, that is another thing. If a student is having an abortion, that is another thing. Whoever could be a staff of an institution is somebody that must have gone into adolescence and being of age. A student being a ward under the institution, that's another story entirely. Even if that student is above 18, we still want to see ourselves as parents, and that whatever such student does is still under our supervision and control. So, and one other thing about abortion in an academic environment is the perception or the stand of the institution will be based on what the constitution, the rule in the country is about on abortion. If a country allows abortion, legalizes it, that's another thing. Then anybody can have abortion. If there is no accommodation for abortion in the constitution of a country, and someone goes ahead to terminate the life of, a fetus, it's another thing entirely. And from that angle, the lecturer or the teacher or the administrator in an institution will not take kindly to it. So personally, I don't think there's any rule in Nigerian constitution that allows for abortion. That is taking of a life. So if a student of mine does that, we will not take kindly to it. We will have to hand over such a student to the appropriate authorities. Yeah, that is another thing. Abortion conducted under the supervision of medical personnel in a situation whereby the fetus is threatening the life of the host person. That may not be too life-threatening, because most general practitioners, gynecologists have been trained to know how to evacuate fetus that are threatening the life of a mother or mother-to-be, because we have situations whereby fetus develop outside the uterus, and they call that ectopic pregnancy, at least by my understanding anyway. And ectopic pregnancies are always dangerous and life-threatening to the host. So definitely doctors that are trained will know how to do that, But when a student goes about using all types of methods, either taking medications, overdose, or probably doing some other things, or physical punching of the tummy just to get the fetus out, that's another thing. That could be very life-threatening. We've seen cases whereby young people, they lose their lives by so doing. As a father, one of the things I must do, which I have been doing and which I will continue to do, is to make sure that my children have what we call sex education. You have to let them know the repercussion of having unprotected sex is pregnancy, infection, and some other things that anybody can think of. So, one, as a father, I don't shy away from telling my children, don't have sex yet until you are married. And if by chance you are from my home, you are not on your own, and you have a partner that you have not really been tied together, in marriage, and you just feel you have to do it, look for a protective measure. There are condoms, there are other contraceptives and some other things that one uses to protect one from unwanted pregnancy, because the risk is more. Then mind you, if you are having unprotected sex, there are other issues now in the society that are even more dangerous than abortion. HIV, STDs and what have you. So definitely, if one wants to live a life of comfort, one has to be conscious of such things. So that is what I would implore my own children, my students, the ones that are close to me, or probably as a counselor in the school, what I would tell any of my female students, and even advise the male to do, rather than to wait until a situation whereby pregnancy comes and life will be threatened in the course of removing such, you know.
Welcome back to our program.
So this marks the end of our program, and I hope you all have learned a lot from our discussion.
Yes.
Thank you so much for your time, and thank you all for being here today. My name is Kwazima Matida, and here with me is the beautiful
Ayoshina Buluwatipestella.
See you some other time, and remember, abstinence is key. Bye.